I'll be explaining care for a tracheostomy. So first I'm going to explain what a tracheostomy is. A tracheostomy is an incision that is made by the trachea, and the stoma is inserted surgically with the inner cannula being placed inside the trachea, and then the stoma will be here and it will be connected to a ventilator. Since I don't have a tracheostomy with me, it'll be quite difficult to show the care for it on a patient who does not have a tracheostomy. So basically, care for a tracheostomy is done in 4 steps. There's a suction of the tracheostomy tube to get rid of all the secretions that come in the airway as a person breathes, and then there's the cleaning of the suction catheter, and then there's also replacement of the inner cannula. It's not done all the time, it's only done when it's necessary. And then there's cleaning of the skin around the tracheostomy. We note for any irritation, any swelling, any bleeding, any pus, any abnormal odor, or any skin irregularities around the stoma. And then also we moisten the air that the patient breathes. So for the cleaning, we use a solution of hydrogen peroxide for cleaning the actual tracheostomy tube. So the tracheostomy is pulled a little bit, and the cotton swabs are dipped in some hydrogen peroxide, and the inner crevices of the stoma are cleaned out carefully, and we use multiple swabs for this. And then also the tube is removed and is cleaned thoroughly with a brush using some soap and alcohol, either the hydrogen peroxide. And then also the skin around the stoma, as I said, is also cleaned using some soap and water to not irritate it. And then the inner cannula, if at all it needs any replacement, we just put a new one. And then for moistening of the airway, we just wet a cotton swab or a cotton cloth, and we put it on over the stoma, and we allow the patient to breathe in for a couple of minutes. We also have to note for any complications to check if the inner cannula is lodged properly. If it is not dislodged, we have to note that continuously. And then also note the skin of the patient around the stoma, and if at all they are breathing properly using the stoma.